Hi, welcome to Skin and Beyond. I'm Dr. Christine Cabell here at DermDox Mohs Surgery Center and Skin Solutions, where we treat a variety of advanced dermatologic conditions. We treat anywhere from skin cancers and skin lesions to your cosmetic concerns, as well as skin wellness concerns here. So today on our show, we're going to cover two related topics: what to do if you're losing hair and some of the procedures we have here that we can offer for that, as well as what to do if you'd like to remove hair from areas. Looking forward to sharing all of that information with you today. Hi, welcome back to Skin and Beyond. I'm Dr. Christine Cabell here at DermDox Skin Solutions and Mohs Surgery Center. I'm learning about hair removal, which is one of the multiple procedures that we do here in the office regularly. So this is a laser called the Modus AZ Plus laser, and not only does it do hair removal, it also treats red spots, brown spots, and can do beautiful facial treatments. But today we're going to highlight the hair removal aspect of the laser, and this is one of our esthetician technicians, Lindsay Ashford, here with our lovely patient, and we're going to talk a little bit about doing some hair removal on the patient's legs. When we first see a patient for hair removal, we evaluate whether it's just sort of your normal desired hair removal just so they don't have to shave, or whether there's something medical going on. So that's the nice thing about being able to come to our office, where we have dermatologists that are able to evaluate the whole picture and work with the patient and decide exactly what needs to be done. And then I'm going to have Lindsay explain a little bit more about how the laser works and how that procedure goes once we decide to proceed with the hair removal laser. One nice thing about our laser that differentiates it from other hair removal lasers, number one, it is pain-free. The reason it is pain-free is because of the technology of this sapphire cooled tip that sits against the skin while the laser procedure is being done and cools the skin and allows virtually pain-free hair removal. It's also very effective hair removal because of the wavelength of light that comes out of the laser is specifically targeted to the pigment in the hair. And the other thing that is wonderful about this laser is it can be used in all skin types. So we could treat from very light skin to very dark skin.
And all year round.
All year round, yes, exactly. It's a very safe laser as well. So at this point, I'm going to hand it over to Lindsay, and she'll go over the procedure.
All right, so our patient here today she wants to treat lower legs for hair removal. So just a typical girl that doesn't want to shave. So what I'm going to first do is just clean off the area with just some alcohol. And when a patient comes in, we generally do a consultation on the phone or even in person prior. So I make sure the patient is not coming back from a vacation with a sunburn, anything like that. If they are, we just, have them wait a week or two, and then always have them shave the day prior, because we want the laser to basically work at the hair follicle at the root, and not have the energy absorbed in the hair that's grown out. Then I'm going to, with the Moveo hair removal, the nice thing about it, like Dr. Cabell said, we're able to treat a big area at a good pace. So we do, our energy is going to be in a 4x4 area. So what I kind of do is just, once you start doing it, you really kind of can see your eye for the 4x4. So just for the purpose of the training, we're just going to kind of mark this off, and we'll concentrate that area, per treatment. So I'm just gonna cover the patient's eyes. Just lay it there. Okay. And then we're going to use just like an ultrasound gel. This just helps for the glide. And generally, we would have the patient come back for legs every 4 to 5 weeks, just depending on how fast the hair growth cycle is. Anywhere on the face, we're going to do every 4 weeks. And then in between the treatments, you can shave regularly, but we ask if the patient doesn't tweeze or wax. If they do so, that's just going to kind of disrupt the treatment. All right, so we're going to start right over here. And are you ready, patient? All right, so we're going to start this. And as you hear the beeping, it's kind of timed for 2,000 joules. So basically, we just kind of do this in the zigzag pattern until it times out, and then we move on to the next area. And how does it feel?
No pain, nothing.
Some patients can feel a little heat. If anything, if the hair is maybe 2 days grown out, you could feel a little pickiness, sometimes on the shin bone or the ankle. But compared to other lasers, which I've used in the past, it's too good to be true almost. It's very, very comfortable. And then afterwards, what the patient, really doesn't have any redness, anything like that. They can return to their normal activity. She can even start shaving again tomorrow. If she's irritated, I always say wait a day. And then we'll go on to this area. It's very easy, a very easy treatment. She'll start seeing results generally like a week and a half to 2 weeks after each treatment. This being her first, she may just have a slower growth overall, and then she'll start seeing some patchiness in between the treatments. And like I said, generally 6 treatments, and she'll be smooth for summertime. A lot of patients use this time to take a little nap because it is so comfortable. All right, so we did those 2 areas there. How does it feel?
Great.
Good. And what we'll do is we'll just kind of wipe it off and just move on with the areas. And as you can see, no redness, nothing. It's just pretty easy treatment.
It's nice there's no aftercare either that's needed. Some of the most common areas we treat besides the legs, we do a lot in the axilla or armpit area. We do a lot of bikini areas. And men, we do a lot of faces as well, especially if they get a lot of folliculitis or irritation from shaving and decide they wanted to permanently remove the hair. We say it's permanent hair reduction. The treatments do last a very, very long time. Occasionally, you would need a touch-up from time to time, but once you go through the series of treatments, you wouldn't grow the hair back again. So that's it for this treatment. Our next segment, we're going to focus on the complete flip side and talk about what to do if you're losing hair, some of the treatments that we have that we can offer for that. Thank you. Hi, welcome back to Skin and Beyond. I'm Dr. Christine Cabell here at DermDox Skin Solutions and Mohs Surgery Center. I'm here with Rebecca Geiger, one of our wonderful physician assistants, and our patient, Nay, who joins us to learn a little bit more about PRP, or platelet-rich plasma, for treatment of hair loss. So when patients come in with hair loss, we do a full evaluation as dermatologists. So we need to evaluate what exactly the hair loss is coming from, whether there's scarring, whether there's the chance of getting the hair to grow back, what the factors that are causing the hair loss are. They could be hormonal, it could be hereditary, it could be inflammatory. So we do a full evaluation. We have services here by which we could check your hormone profiles. We can do biopsies to determine what the best treatments are. Right now, one of the best treatments for hair loss happens to be platelet-rich plasma, which was originally FDA approved for treatment of joint disorders, but it's widely used in the cosmetic industry, plastic surgery, ophthalmology surgery. And the basics of the procedure are that we draw the patient's own blood into tubes like this, your standard looking blood tube. It then gets centrifuged and we draw off the top layer, which is very, very rich in concentration of platelets. And again, it's the patient's own platelets. Those platelets are able to release multiple growth factors and anti-inflammatory molecules. There are over 800 molecules that those platelets hold that can help reduce inflammation and help kickstart hair growth. So it's then re-injected into the scalp of the patients in the areas of hair loss. We do a series of treatments, and it's very effective. Rebecca is going to talk a little bit more about the procedure, and we're going to demonstrate the procedure today with Nay.
Okay, so we are here today with Nairobi. It's a combination for Nairobi, a little bit of traction alopecia. So that is when the hairstyle is too tight and it's pulling on the follicles. So then those follicles get irritated and the hair follicles stop working. So then you lose the hair in those. And hormonal. So she kind of has a combination of hair loss from that. So what we're going to do today is we're going to concentrate on the front area of her scalp. First we start with drawing her blood, and then like Dr. Cabell said, what we'll do is we'll put it in the centrifuge to have everything separated, and then we'll show you what that looks like once we get to that point. So I'm going to go ahead and get her ready to do the blood draw.
So the blood's going in the first tube right now. As soon as that fills, we'll do a second.
Okay. All right, so the first part's done. Put her arm in like that one. And then what we do is we place these opposite each other in the centrifuge. Okay, and I already have the settings on, so then I'm just going to hit start. And that'll spin for 9 minutes. All right, so it's all done spinning. And you can see how it is separated. So down here is your red blood cells. Your center layer is platelet poor plasma. And then up here is your platelet rich plasma. So we're going to take this off, and we're going to put an activator in there to make it more potent and work faster. And then that's what we will put in the scalp to help with the hair regrowth.
We're just drawing up the activator, and we'll add that to the platelets.
Okay, so then what we do is we put the activator in there, and it's all combined in one syringe. And then we work it back and forth a little bit so that it continues to mix. And then we start our injections into the scalp. So as you can see here, this is the area we're focusing on, is the frontal part of her scalp. So what I'm going to do is I'm going to go around and do little injections and create little bumps along that area so that we can stimulate hair growth. Are you feeling any discomfort with it?
I am not, no.
So it's a little tiny needle that we're using for the injections. We're just going right underneath. Still doing okay?
Yes.
Good. What I tell people is to sleep with that head elevated for the first night, because you may get some swelling from the scalp that kind of settles down into the forehead or even makes the eyes look a little puffy initially, and that's completely normal. You can wash your hair after 24 hours and resume normal activity. Just no strenuous activity for the first 24. Take it easy. And that's what's nice about this procedure, is that it's effective with little to no downtime. With these treatments, we usually do recommend that you do a series. So anywhere from 3 to 4, depending on the amount of hair loss and what we're trying to achieve. You space them about 4 to 6 weeks apart, depending on your schedule. And you can always use it in conjunction with something like Nutrafol, which is a supplement that helps with hair regrowth as well. It's just an added benefit from that. All right, I'm just kind of going back through here and covering any spots that I may have missed. This is really where she has like the areas that's the thinnest. So I'm going to go back in and just put a little bit more in through there. Make sure we really hit that area that we're targeting.
And we definitely do men and women with this procedure. It's always better to not wait until the hair loss progresses more. So I say it's good to get in, at least for an evaluation, and maybe talk about some of these treatments when you first start to notice the hair loss. It's much better to treat it early. It's much more effective.
Yeah, because you're working on those follicles that are there that are dormant. It's going to, bring those back to life with the growth factors. Once the hair follicles are gone, we can't do anything to bring those back. Okay. All right, you're all done. What'd you think?
It was really good. It didn't hurt.
Good.
I hope you enjoyed learning about the platelet-rich plasma treatments for hair loss. I'm going to be back in the next segment with Cassie Manganelli to talk about some of the wonderful products that we have here, including some of those that we highlighted for hair regrowth.
Hey everybody, it's Cassie at Skin Solutions, and we're going to go over some of our skincare products we have here, as well as our vitamins, chemical peels, eye drops. We have a couple different things to talk about today. So we have our line of SkinCeuticals that has a couple different products that we have. We have cleansers, we have retinols, we have sunscreen, we have antioxidants, something that your skin should be using every single day. Sunscreen, cleanser, antioxidant. Down here we have our Skin Medica line, which is our most popular. This is the TNS Advanced Serum, which is their most popular product that they have. Has a growth factor in it, and it is clinically proven to help the look of the skin, to help lift the skin, and to help with sagging skin. HA5 is their other most popular product. This helps keep the hydration into the skin. Next up, we have our PCA line, another medical skincare brand. We have a couple different oil cleansers, facial cleansers, creamy cleansers, toners to really balance out the skin. We also have a peptide serum, which is kind of similar to what we have over here with our TNS. Also has a growth factor in it. We have a couple different antioxidants as well. And then we are going to talk about Nutrafol. So this is going to go along with the PRP that Dr. Capel and Rebecca had just spoke about with Nairobi. So we have women's, we have men's to promote the hair growth and really target those follicles to help. The women's one we have for peri and postmenopausal, which is one of the symptoms that we deal with as women as we get older, hair loss. PRP can help, but this is the back end of things that you should also try the Nutrafol. It's a vitamin that you take daily. The ones that we have here is their 3-month supply. We also have our chemical peels. So we have a couple different chemical peels. Today I'm going to talk about the VI peel. So that is a medium depth chemical peel, reaches all the way down to the dermis, brings all that stuff up to the surface that us as women and men don't like: sunspots, wrinkles, fine lines, melasma, rosacea. Those are all skincare concerns that we deal with on a daily basis. There's different kinds. We have the original, Precision Plus, Purify with Precision Plus, Advanced. And then we also have an aftercare kit that you can take home to help with any pigment that you have left over after the peels. We also have Latisse, which helps with eyelash growth. That gets applied at night right on the lash line, helps the lashes grow. And then the last thing I'm going to talk about is our Upneek. So this is a drop that you put in your eyes. Some of us deal with saggy lids, something like that, and then we put the drop right in the eye, and it helps open the eye and make it more bright and white looking. We have a ton of different skincare products, a ton of different services, so don't hesitate to give us a call. Again, my name is Cassie Manganelli. I'm one of the estheticians here at Skin Solutions.
Thank you, Cassie, for the wonderful description of our products here at DermDox Skin Solutions. I also wanted to mention that in the month of March here at DermDox Skin Solutions, we have a special. If you purchase 50 units of either Botox, Zeman, or Daxify, you get 10 units free. Again, that's buy 50 units, get 10 units free in the month of March. On the next segment of Skin and Beyond, we're going to talk about some things to help you get ready for the summer. We do some body contouring treatments here with Physique and deep radio frequency microneedling procedures, as well as provide weight loss consultation and medications. So I hope you join us at that next segment to learn about some of those other treatments that we offer. And thank you again for joining us today at Skin and Beyond at DermDox Skin Solutions and Mohs Surgery Center.